Good morning and welcome to the Monday morning COVID-19 briefing here at the Kern County Board of Supervisors Chambers. Today we have with us our CAO, Ryan Alsop, our Public Health Director, Matt Constantine. We're also joined by Kim Hernandez, our lead epidemiologist, if you have any questions. So first, today I'm going to get started and we're going to ask Matt to start with our information from Public Health.
Good morning, Megan. Are you able to hear me okay?
We can hear you. Thanks, Matt.
Great. Well, good morning, everybody. Thank you for joining us on this rainy Monday morning. This morning, we are reporting that there are 22 new cases of COVID-19 in Kern County residents. I want to provide just a very brief update on some of our skilled nursing facilities and a couple other items, and then I'll ask Megan to give us an update on the testing updates, and then of course to Ryan to update us on some county-wide issues. So the Kingston Healthcare Center, this is as of May 15th, this is Friday, the state has reported to us that there are 49 residents that have tested positive. There are 75 healthcare workers that have tested positive, and unfortunately 12 deaths of residents from Kingston. So this is numbers that the state has provided to us. Staffing has been a concern, as we've been reporting on. We had a medical assistance team that was deployed through the state assisting Kingston with staffing issues. That deployment is starting to run down, and they are intending to leave in the coming week. There's a few of this medical assistance team that's leaving today, and there's some tomorrow and then some Friday. There'll be about 18 team members that will remain until the 26th, until just after the holiday. Kingston has reported to us that they have brought on 4 additional nurses that will be starting tomorrow. We'll continue to monitor staffing. That continues to be a concern of ours. We're hopeful that these new employees that Kingston's bringing on will help in the transition so that they can assume their full responsibilities. Valley Convalescent Hospital is another skilled nursing facility that is regulated by the state and has recently started to raise some concerns at the county level. Again, as of May 15th, Friday, the state has reported to us that there are 17 residents that have tested positive. There's 9 healthcare workers that tested positive. There's no deaths associated with the site, thankfully, and staffing is okay for the immediate future. It's important to note that if we put all of our state-regulated skilled nursing facilities together, they represent 52% of the deaths in Kern County. We mentioned last time that FEMA was going to provide some personal protective equipment to all of our skilled nursing facilities, and that is still on target. That is supposed to happen the 20th or the 21st. They've indicated that they will provide a 2-week supply of personal protective equipment to all Kern County skilled nursing facilities. So that is great, and we're grateful we have that resource coming in. We also announced last time that we created a skilled nursing facility testing program. So the state has asked all of our 19 skilled nursing facilities and all skilled nursing facilities in the state to develop a testing plan to test both residents and staff on site. They've given them several weeks to develop this new program, but in Kern, we didn't want to wait that long, obviously because of the concerns it's having on the impact to those residents and the staff in our skilled nursing facilities. So beginning Friday, we deployed 5 individuals that went out to Valley Convalescent and started testing ourselves. This is incurred at the county's cost, but it is intended so that we can identify those that may be positive earlier so that we can help mitigate any transmission to any other staff member or any of the other residents that live within these facilities. So we tested 56 employees on Saturday under over 2 shifts. And we came back, 2 shifts on Friday. Then we came back on Saturday and tested an additional 14 employees for a total of 70 employees that the county tested at this skilled nursing facility. Today and tomorrow, we are going to San Joaquin Nursing Center. There's about 100 employees that we intend to test, and so that we can provide that information to the state and to the facilities so that they can make some good decisions about infection control and hopefully limit any potential exposure going forward. So with that, that's the extent of my quick update. And Megan, if you don't mind, I'd like to turn it back to you, and if perhaps you could talk about the county and state-sponsored testing sites.
Absolutely. Thank you, Matt.
Thank you.
As Matt mentioned, we have multiple testing sites available to Kern County residents. We break them into 2 categories for our own purposes. The first is our state-provided sites. Right now, all of our sites require an appointment. They're free at the state level. They're free at all levels, but at the state level, if you have insurance, they will bill for it. And then there is no screening criteria at any of our sites. So the first 4 are our state sites. The first one is at the Kern County Fairgrounds. There is one at the Mojave Veterans Hall. There's also one at the old Arvin Public Health Building. And there's the 5th District drive-through, which is at our Richard Prado Senior Center, right off of Mount Vernon. The next set are our county-provided sites, and these are funded through the county. They also require an appointment. They are free. There is no screening criteria, and they operate through an existing service provider. So we have multiple partners. The first is in Oildale with Good Samaritan Hospital. The second is in Taft with Westside Healthcare District. The third is in Delano at Delano Regional Medical Center. And the fourth is in Ridgecrest at Ridgecrest Regional Hospital. So those are all open now. If you're interested in scheduling a testing appointment, you can go to kerncounty.com, and right on the front page, there's a large button that says COVID testing sites. You can click on that and get all the registration information for these. We also have 2 additional sites that will be coming online soon. Tehachapi at the Adventist Hospital there, as well as in the Kern River Valley at Kern Valley Hospital. Those are not up and running yet, but they will be soon. With that, I'm going to turn it over to our CAO, Ryan Alsop.
All right, thank you, Megan. Good morning. Thank you, Matt. Want to wish everybody a good Monday morning. I hope you're all well and enjoying the misty start of the week here in Kern County. Today in Kern County, as we've reached over 16,000 tests administered for COVID-19, over 80% of those tests have come back negative. Of the nearly 1,600 tests that are pending results, the vast majority of those are likely negative. In many cases, as has been reported, as we have said in the past, with negative tests, public health must work to seek out that information. It's not like getting a report back, which is mandated on a positive. We actually have to go and seek out confirmation that certain tests were negative, if in fact they were, before we're able to publish that data, and it requires some work. Sometimes we're successful in getting that information quickly, and other times we are not. Today, of the 1,537 positive tests of our residents for COVID-19, nearly 1,500 of those residents, or 96%, have fully recovered or are recovering at home. In Kern County, on a daily basis, since late March, tracking the numbers, 96% of those residents who have tested positive for COVID-19 have either fully recovered or are recovering at home, treating their symptoms on their own. 36 people, or 2% today, who have tested positive are receiving some form of treatment in an area hospital. And as Matt alluded to earlier, 25 people have died since we began publishing COVID-19 data here in Kern County. And according to state public health officials, just over half or 52% of total deaths in Kern County are related to patients at 2 different state-regulated skilled nursing facilities in our county. As we've said before, the governor has moved the state into stage 2 of the reopening plan, of his reopening plan. There are multiple stages. There are also multiple phases within that stage 2. There are only certain businesses that are allowed to operate right now within stage 2, with some ability for those businesses to expand their opening as we move through the phases of stage 2. The county, as you know, has been asking for greater latitude in how we more quickly reopen certain businesses within stage 2. And we would be doing so within the guidance that's being provided by the state. Most of you know by now that we joined forces with the CEOs and the chief medical officers at all 10 acute care Kern County area hospitals in seeking this additional flexibility. And we know that that communication and our requests have been seen by Governor Newsom and his team. We appreciate the governor's time and his full attention. We know he and his team are giving our county's requests full consideration, and we appreciate that. The communication has been very good. I want to thank our area state legislators for their work in helping deliver these messages and these communications and working with us in tandem to seek these additional flexibilities locally here for Kern County. And we, all of us, look forward to seeing how this develops as the governor this week through his press briefings begins to move the state forward this week. We continue our ad hoc committee of the board, which is 2 supervisors, Supervisor Maggard and Supervisor Scrivener. We continue to have discussion with industry groups here in Kern County. We're focused on getting, again, all businesses that we are able to reopen. Those businesses that can reopen now, we're focused on getting those businesses reopened as quickly as possible in the safest and most responsible manner. Again, last Thursday, I talked about a board meeting that we're having here tomorrow, where we'll be talking about financial assistance to area small businesses. I would ask you to pay attention to that, and information on that will be forthcoming. As in addition to that, tomorrow we'll be talking with the board about budget issues that we anticipate having, not just in the short term, but the longer term, due to the response to COVID-19 statewide. And we, again, last week talked about the county coming back to work. I want to be clear, we've had questions. The county has not flipped a light switch, and we are not back at full service and full personnel today. We moved into this week under the same essential staffing model that we have been operating under for the last month and a half or so. And what has changed, however, is that this week we are working with departments on transition plans to begin to reopen a little more fully, with bringing back a few more staff, providing some additional services. And where that happens will be different among the different county departments and the business that they are providing the public, but those transition plans are in the works. We're talking through them. We've started really last week, but we're going to be implementing those plans this week and in the weeks ahead. And anybody that has any questions or anybody that is seeking information on county reopening plans can find the latest, most updated information on our website at kerncounty.gov. outbreak.com. We're going to be basing the reopening again on our ability to do it safely, where departments are operating under guidelines that are blessed by our local public health officials. We'll be doing so in a way that allows for those plans to be implemented and in a way that those plans can be sustained over the coming weeks. And that is a major guidance on determining how we reopen. Obviously, the other one will be based on the budget realities that we face here in the county, and reopening back up at fuller capacity, no matter what department is being asked to do that. Those departments will be considering the very real and severe budgetary impacts that we believe we will have, not only here in the short term, but in the longer term due to COVID. And with that, I will be happy to hand it over to back over to Megan and answer any questions you might have.
Thank you, Ryan. As we sent out in the notice this morning, we're going to do questions a little bit differently. When everybody unmutes, it creates a problem for the sound and everybody's ability to hear. So we're going to call you like we have been. Please wait to unmute until you've been called to ensure that we don't get feedback from any other lines. So we'll go down the list as you've been provided. First on our list is Channel 17.
Hey, Ryan, Matt, and Megan. It's Eitan Wallace with KGET. Just making sure you can hear me.
I can hear you. Good to hear you.
Excellent, Megan. You as well. Thank you so much. And Ryan, thank you for providing the update on the letters you and those 10 hospital CEOs and leaders sent to Governor Newsom for greater latitude in how we more quickly reopen certain businesses within Stage 2. Just wanted to get your thoughts. Has the governor's administration indicated where the governor is leaning in terms of your letter and how he may respond to it? And do you have any indication when he may provide an official decision?
Eitan, I'm going to have Ryan answer that one.
Sure.
Hey, Eitan, we don't have any specific information on when and how, but we do have confirmation that the communication has been received. It's been read. I would surmise that it's being considered, and we obviously would like to see a turnaround on that as soon as possible. I mean, we would like to begin moving through the phases of Stage 2 as soon as we possibly can. So we look forward to hearing from the governor and his team, hopefully as soon as this week, on any changes that they propose to their guidance for counties. And I hope that answers your question.
Thank you.
Thank you, Eitan. Next on our list is KNZR. Do we have anyone on the line?
Hello, this is KNCR. Can you hear me?
We can. You're a little muffled, so be sure to
Okay.
speak up.
Okay. I'm wondering about the number of Hispanics that have reported to have the disease. We're at 65% or so with them. Is that a matter of concern, and is there anything that the health department can do about that? My second part of the question would be, there are many more people seem not to be wearing masks now that we're trying to reopen the county. And is that a concern? And is the health department planning to do anything to inspire people to be more compliant with social distancing and masks?
Okay, so if I think I understand your question, let me just play that back to you to make sure I direct that the right way. You're asking about the demographic breakdown of our results that is provided by Public Health through their dashboard, and mask or face covering issues that you're seeing out in the public. Am I correct?
That is correct, yes.
Okay. Matt, are you able to answer that question, or do you want me to have Kim answer that?
Sure. Let me try, and then Kim could probably provide some epidemiological background to this. And that question is well received, as you see that Hispanics represent 66% of the cases. So it's important for us that we outreach to those that are most affected by this. We have put a lot of our material in Spanish. We continue to outreach to the Spanish-speaking community. So that is something we track very carefully. As it relates to masks, the guidance from the state and federal government says that face covering should be worn when you can't achieve social distancing. So our message remains the same. We need to do everything we can, everything possible, to not only protect yourself, but to protect your community, to protect perhaps your older neighbor or your grandparents or your parents or the community as a whole. This is our obligation to do everything possible so that we continue to flatten that curve, so that our hospitals remain viable and not inundated, so that we can be granted some variants, so that we can hopefully open up the economy, as Ryan had mentioned. So we will continue our efforts to continue to encourage people to adhere and to do everything possible, not just wearing masks, but every other action we take so that we can make sure that we're safe.
Thank you.
Okay, thank you.
Thank you. Okay, next we have KUZZ. Do we have anyone on the line? Okay, I'm going to go on. If we miss you, we can come back to you later. The Bakersfield, Californian. Do we have anyone on the line?
Hi, yes, this is Stacy.
Hi, Stacy.
I wanted to ask, both Matt and Ryan have made distinctions when they're talking about the nursing homes, specifically noting that 52% of the county's deaths are from nursing homes, and I just wanted to get some clarity on that. Why we're making that distinction? Is it because they're state-regulated facilities, and do you feel that those deaths somehow shouldn't be included in our overall tally, or are you just trying to make some other point? I guess I'm just wondering what is kind of the distinction that you're trying to make when you point that out.
Okay, thank you, Stacy. I think they could both answer that question. So I'm going to pitch it to Matt first, and Matt, go ahead and share what you want, and then I'll have Ryan step in afterwards.
Hi, Stacy. Yes. So we are identifying that the state provides us information about deaths associated with skilled nursing facilities. Unfortunately, that number is high. These are state-regulated facilities. The county has no involvement, typically. Obviously, we're dealing with an immune-compromised population that is more susceptible to this virus. With that said, I think that we need to do everything we can to protect that vulnerable population. I worry about the state of the skilled nursing facilities. I worry about the staffing and how they're impacted. I worry about how more than half of the deaths have occurred really at one site. And I think that identifies areas that the state needs to allocate more resources so that we can do even more. So this is one of 19. I want to make sure the state's doing more to protect the other residents and the other sites. We have routine conference calls with them. We've had some of our state assembly members on the phone with us. We've asked the state to give us updates routinely. As you've seen now, in a rather uncharacteristic manner, we've decided to spend county money on and time and resources on testing individuals in skilled nursing facilities. So I remain concerned, and I think this is an area that we all need to focus more on.
Yeah, Matt hit it pretty well, Stacy, but I will just say that for all the reasons Matt just laid out, this is relevant. It's relevant to our announcement and publishing of data. It's relevant in our community's consideration for how we move forward, particularly through the accelerated reopening, the county variance issues within stage 2. It's relevant, and we're simply asking the governor to acknowledge that it's relevant and to give full consideration to the fact that as it stands today, 52%, over half, just over half of our total deaths here in a county of 8,000 square miles and 900,000 plus population are attributed to state-regulated skilled nursing facilities.
Do you feel that these should not be factored into some of these metrics, for example, the deaths? I mean, have you taken a step of asking that they not be considered, or have you considered that they not be considered?
We have asked the governor for consideration that they not be, that we distinguish between the total number of deaths countywide and those at these two skilled nursing facilities as it stands today.
Okay, and have you done the same thing for testing when there's positive tests?
I'm sorry, Stacy, could you repeat that?
Are you also asking for any positive tests from those facilities to be differentiated?
I think that we're asking for differentiation specifically on the death totals, but more broad a differentiation, distinguishing between these particular congregate care facilities and the overall numbers in the rest of the population. I think are relevant to considering how we move forward as a county with reopening certain businesses.
Okay, thank you.
Thank you, Stacy. Next on our list is Kern Radio. Do we have anyone on the line?
Yes, it's Ralph Bailey. Good morning.
Good morning, Ralph. How are you?
I'm good. Can you give us some more information on the 48% of the mortality in terms of an age demographic and whether or not those folks had any pre-existing conditions? We know that at least one of those fatalities had massive cardiovascular disease, the woman in Delano. Can you give us any more information on those folks? And how closely are you all tracing these healthcare workers who are patients in terms of where they've been and who they've come in contact with?
Yes, Matt, I think that's a question for your team. Is that something you're able to answer?
I'd like to ask Kim if she could stand up and answer. She has some more specific detail than I do.
Okay, awesome. Give us 1 second. We'll have Kim, Ralph, we're going to have Kim respond to your question.
Thank you.
Ralph, can you do me a favor and can you restate the question one more time?
Sure. I was asking for information about, you identified that 52% of the deaths are from nursing facilities. Can you give us any information on the other 48% in terms of an age demographic or any existence of a pre-existing condition? And I said, we know that one of the victims, the woman from Delano, had massive cardiovascular disease. Can you give us any other information on those people?
Unfortunately, at this time, we're not able to provide additional information on the other deaths. I can reassure you, though, with the question regarding our healthcare workers, that when they are identified as positive, we work both with the staff member as well as the facility that they work in to identify all of the other staff members they've been in contact with, and especially all of the patients that they have been in contact with, so that those people can be notified that they may have been in contact to a confirmed case, and that they can be closely watched if they are patients, and to ensure that if they do develop symptoms, they can be tested. And so for every positive case that is identified, we go through a rigorous process of our staff evaluating where they have been in close, prolonged contact with others, so that those people can be notified that they can self-quarantine at home, and that they can watch themselves for symptoms, as well as be able to contact us at the health department if they have additional questions. Thanks.
Thanks, Ralph. We'll keep going down the list. Do we have anyone from Channel 23 on the line?
Hey, good morning. This is Brian with 23. Just first want to say thank you guys for continuing to have these and keeping the community informed. My question specifically for Ryan, I'm also interested in what Matt has to say about this as well, but as our county is focused on, reopening at a faster rate because of our unique circumstances here, is there any concerns of a second spike? Obviously, with more people, interacting, I'm sure policies are in place on how they could interact, but with more people out, more tests happening, the numbers I wouldn't suspect would not go up. So what are the conversations about what happens if we do have an increase of some kind if we do open up a little faster? And is the county concerned that that might hinder our overall ability to reopen in the coming stages?
Brian, thank you. That is a question for both Matt and Ryan, so I'll have Ryan start, and then we'll ask Matt to weigh in.
Just thinking about how I answer your question, where to start on that. The governor has provided a pathway and has acknowledged that there are regional variances that exist within the statewide, within the 58 different counties, and within their own regions. And acknowledging that he and his team have provided a pathway to, again, moving businesses that are now open in stage 2 to open slightly wider with their operations under guidelines. And that is what we are seeking. Our county is seeking the ability to move those businesses in stage 2 to reopen their operations in a slightly wider capacity. It's not back to where they were before all this. It is at a slightly wider capacity, operational capacity than they're operating under today. And that's what we're seeking. The governor has provided a pathway for that. They've acknowledged that that is something that is important, is relevant, and they're giving us the ability. Now, with the county's attestation, which is the plan that we would be giving to the governor, and I'm hopeful that we could be getting that to the governor this week, depending on how things go, concerning the requests that we've made and the interaction that we've had with them, the engagement. Those attestations, those plans have step backs. Obviously, if some key indicators, some key data points begin to skew, begin to elevate and evolve in a way that give us a determination that things are getting much worse, then we, in those plans, are to demonstrate how we step back, and it would essentially be a step back into a more sheltered approach to opening things and movement around the county. So that is something that is considered as we go forward. But I want to make a point that the letter that was sent last week by the county, along with the leaders in our medical community all across Kern County, the upshot of that letter is this. The rate of hospitalizations in this community, which today is about 2% of the total number of tests given, the rate of hospitalizations going forward is the best indicator to determine the county's readiness to deal with issues related to COVID, transmission within our community related to COVID, to a doctor, to a hospital CEO, to our public health officer, our public health director. Hospitalization rate is the primary indicator, we believe, and the best indicator to determine Kern County's readiness, specifically to move through the stages, or the phases of stage 2 more quickly, as opposed to simply reporting the rate of infection and even the rate of death. So that's the upshot of the letter. I think that's an important takeaway from our medical community, and I hope that answers your question, Brian.
Thank you, sir.
Matt, before I go on to the next one, did you want to weigh in on that?
You know, I think Ryan did a really good job at answering. We are required in the plan that we are submitting to the state to provide what they call a containment plan, just as Ryan said, that ensures that we have the ability to provide early recognition of increase in cases and the ability to respond and to address those cases. They have specific requirements in the variants so that we address contact tracing and an ability to house those that are homeless that are infected. So there are components within that variance that we have to demonstrate we are ready. And it's also good to note that, you know, these phases within stage 2 are just that. They are phased in. So if we eventually are in a position where the governor allows us to proceed, this is a phased approach and we monitor it. And that's the intent of this, so that we can watch it closely over time to see how we do as more industry opens up.
Hey, really appreciate that. Thank you for that in-depth answer, Ryan and Matt. And also just a heads up about the website. I noticed that the negative tests went from 12,987 down to 12,913. Is that some kind of glitch, or was that just a different account error?
So I can try that, Megan. So I'm assuming we're talking about on the county's website that shows, I think you tried to, did you say negative tests went down? Did I hear that correctly?
Yeah, it was at 12,987, and then it now says 12,913.
I see that. Kim, are you able to address that, or is that something we should address later?
She's coming up. We'll have Kim talk about that one quickly.
Certainly, a lot of that is us trying to reconcile all of the test results that we're getting. We do unfortunately find errors in results where a person's name is misspelled or a date of birth is in error. So as we catch those, we reconcile them. And so that's why sometimes there's some fluctuation as we find also duplicate reports of patients. We're trying to always give you the best and most current data. And so some of that does include combining duplicates that we know about. Thanks.
Thank you, Kim.
Thank you.
Okay, next on the line we have Kern Soul. Do we have anyone on the line?
Hi, Megan. Can you hear me?
I can.
Okay. This is Elizabeth from Kern County News. My question is, last week, Matt said that Kern County was averaging 30 new cases a day, and I was just curious to see if we're still averaging 30 cases a day, or if that number has increased or decreased since last Monday.
Matt, are you able to answer that question?
I can, yes. We do look at the average number of daily new cases. It fluctuates, of course, because the numbers on a daily basis change. We have seen some significant fluctuations up and down. As I look at the data right now, if I'm not mistaken, it's about 26 average new cases a day. So hopefully that answers the question.
Thank you.
Yep, thank you.
Okay, next on the list we have Mojave Desert News. Do we have anyone on the line?
This is John Bennett from Mojave Desert News.
Hi, how are you?
Pretty good. I was just wondering if we have any numbers for the East Kern side of things, as far as the number of tests conducted, even specifically the Mojave facility that's only recently been open. I know we have 5 cases in Cal City, 2 in Mojave, 19 Tehachapi, and 33 Roseman, but out of how many tests?
So Matt, I can take a stab at that unless you want to jump in.
No, go ahead.
Okay, so we do track that information we have access to it through the testing sites that the county is either funding or that the state has funded, provided that they send us that information. So at my fingertips, I don't have those numbers for you. Just recognize I will gladly go get them for you. I cannot include necessarily those from the private facilities that may have sent them off. Those are maybe a little bit harder to track. So I'm happy to send that to you later today with an update.
Sure, that'd be great. I appreciate it.
Anytime. Any other questions on that one?
No, thank you.
Okay. Next on our list is Channel 29. Anyone on the line?
Hi there. Can you guys hear me?
We can. Go ahead.
Okay, great. Good morning. Fiona Dager here with Channel 29. I was wondering, is there any reason why the testing program for skilled nursing homes is starting at San Joaquin today? Are there any indicators that this facility could become another hotspot similar to Kingston? And piggybacking off of that, will the county be seeking any reimbursement for the testing at the skilled nursing sites that are regulated by the state?
Matt, you're probably best positioned to answer that. If you want me
Sure.
to fill in any blanks, I'm happy to at the end.
Sure, no problem. So the first question is, we were at Valley Convalescent Friday and Saturday. The next on the list was San Joaquin. You're asking the order. We have 19 to go through. We're going to each one. We want to identify those that may not have started. We know that some skilled nursing facilities have a program in place and have indicated to us that they are testing routinely, perhaps every 14 days. We're trying to verify that. We want to make sure we use our resources in the best manner, but I'm not aware of any reason the next one was chosen. Clearly, we picked Valley Convalescent because we had some concerns there. And then to answer your second question, my first and primary interest is identifying cases first in those skilled nursing facilities and taking action, immediate action that prevents the transmission to another resident or another staff member. Reimbursement will come. Yes, we are going to try to seek reimbursement for all that we do. It should come from the skilled nursing facility itself, but I'm going to view that as a secondary issue. I want to get in there now, and I want to identify those cases early, and we'll deal with reimbursement later.
Great, thank you.
Thank you, Matt. Okay, we've made it through the list. Just want to make sure we have answered everybody's questions. We want to thank you for taking part today. We'll be back again on Thursday at the same time, sharing updated information. In the meantime, if you have any questions, you're more than welcome to reach out to us, and we'll try and get you answers as quickly as possible. Thank you.